The United Christian Hospital here in Hong Kong has introduced a new non-invasive treatment for patients with nerve pain. Known as Scrambler therapy, the remedy retrains how the brain processes pain signals and is said to help reduce as much as 79% of nerve pain. Dr. Charmaine Chu and Nurse Wong Man Chun are here today to tell us more. So first off, Dr. Chu, tell us, how does the Scrambler therapy work?
It works via information theory. So it's different from conventional clinical modalities, which works on blocking the pain pathway. So it actually directly works on the pain pathway. So this machine consists of artificial neuron, which produce some non-painful signals, which will be transmitted through our C fibers to the brain, so that our brain will be retrained, because the brain will interpret the non-painful signal as the endogenous one instead. So through consecutive sections of Scrambler therapy, we can decrease the long-term potentiation of the maladaptive central nervous system pain pathway, and then it can lead to a sustained pain relief.
What's the current treatment for chronic nerve pain anyway?
Oh, actually, chronic nerve pain is really difficult to treat, because it's a sort of disease or lesion in the somatosensory pathway. That is our either peripheral nervous system or central nervous system. So ordinary sort of painkillers are not useful. That's why we need to use special medication like the first line would be anticonvulsant or antidepressant. They are not painkillers, but they are used for nerve pain. The second line would be like topical niclocaine patch or topical sort of capsaicin patch, which is second line, while the third line would be opioid like tramadol. But these are associated with significant side effects, because people may have like cognitive impairment, or they will feel dizzy, drowsy after taking those medications. And of course, if we are using opioid, then there may be chance of getting addiction or tolerance. Apart from that, we also use some other non-pharmacological technique, like physiotherapy and some rehabilitation, psychotherapy like cognitive behavioral therapy. But for some patients who are having really bad pain, we will introduce some pain intervention. Like nerve block, we can perform some nerve block using local anesthetic or steroid, and technique like pulse radio frequency on the nerve. These are for neuromodulation, and for some nerve ablation, we can also put in alcohol, phenol, or even apply heat radiofrequency or cryotherapy to those nerves, to like you say, like we say, destroy the nerves, so that to decrease the pain. But they're really something invasive.
Are there also, is there a thing called TAN stream? Is that,
you're right,
comparable to
yes,
this treatment?
Actually, it's not exactly the same thing. For TANs, actually, it's also non-invasive compared with Scrambler therapy. However, their theory behind is really different. As I mentioned, Scrambler therapy works on C fibers, which is the nerve conducting painful signal. But for TANs, it's using gauge control theory. So it's not using the C fiber itself. It used the fiber called A beta fiber. So A beta fiber is something larger, and it's conducting other sensation like touch sensation, pressure sensation, joint movement like proprioception. So the theory behind TANs is gauge control. So we send another signal so that there is a gauge in spinal cord to decrease or block the signal from C fiber, so that the painful signal cannot be sent to the brain.
Right, okay. It's like blocking it rather than retraining it.
Yes.
Okay, so it's quite technical that way. But what are some of the most common types of chronic pain in Hong Kong that you have seen?
Now, actually, according to literature or our pain clinic, around 35% of Hong Kong population are having chronic pain, but most of them are having musculoskeletal pain like back pain, neck pain, or shoulder pain, or joint pains. However, around 9% of patients in our locality are having neuropathic pain. So neuropathic pain are those nerve pain, which are really difficult to treat, and this Scrambler therapy is really made for them.
Right. And how many of those patients would be helped by this treatment then?
Maybe let me talk about the indication of Scrambler therapy, then you would know who would be indicated and how many. So Scrambler therapy are usually used for those neuropathic pain. That is, we can divide neuropathic pain into peripheral one and also central one. Peripheral one like post-hepatic neuralgia, that is those patients who have herpes zoster, and after 3 months they still have pain despite all those lesions have been healed. This is one of the indications, and I think there is quite a large number of patients having this. And of course, chemotherapy-induced peripheral neuropathy, diabetic neuropathy, and even some of the patients having those radicular pain like sciatica or post-surgical pain. Because some patients having the operation done, and actually there will be some nerve damage or nerve injury during the surgery. So these are also suitable candidates. So I think, as I mentioned, 9% of the population are having neuropathic pain, and I think among them maybe it really depends on whether they have any contraindication as well. Should I also talk about the contraindication, like who should not be taking?
Okay.
Yeah. Because for them, for those patients fulfilling the criteria to attend Scrambler therapy, we also need to screen out those who can't do this, which include having patients having some implantable device like a pacemaker, and or those who have brain damage or seizure history, or having some sort of vascular stents or vascular clips, or having a recent neurolysis, or we mentioned about nerve destruction pain procedure, right? And also those who are having pregnancy.
Okay. So, but it sounds like a lot of the patients who would benefit from this treatment are those with who like recovering from surgery.
It can be, but actually the post-surgical neuropathic pain is maybe, it depends on different types of surgery. But as I mentioned, a large amount of patients having chemotherapy would have chemotherapy-induced peripheral neuropathy and also post-hepatic neuralgia. I think in our clinic, most of them are from this category, although we also have some sciatica
and some
fell back surgery syndrome.
Okay, so you introduced this treatment almost a year now. How many patients have used this?
Almost 60 patients received the treatment since
60.
Since we launched the service.
So very small so far. And what has been their feedback?
It's quite good. It's about we have some results from the first batch of patients, about 28 patients, and more than 80%. About the mean pain reduction is about 80% after the treatments, and they receive in average 10 sessions of treatments, and each session lasts for 35 to 45 minutes. And then after 1 month, we evaluate them, and the effect can last for 1 month, and with 50% reduction still.
So how often would the patient have to use this to undergo
They
this
have
treatment?
to come daily.
Every day
Every
for
day.
how long?
In average, it's 10 sessions.
10 sessions.
It's about 2 weeks.
Before they can start seeing and feeling a difference?
No. It depends. Because sometimes the patient's feedback the variation is very big. Some patients may have some significant pain relieving effect in the first few sessions, and some of them may have it more than 9 sessions. It depends.
But on average, by the 10th session, there is a difference. Okay. Okay. So where can patients then receive this treatment?
Actually, according to my understanding, only 2 public hospitals in Hong Kong are having this service, including our hospital and also Kwong Hospital. So for patients who are eligible to enter the public health system, they can have their referral from their doctors, and then we will screen the referral and we will arrange our section to review the patient to see if the patients are indicated to have and rule out any contraindication, and then we can arrange sections
appointment for them.
Okay. Are you aware if this is available in the private sector as well?
We're not sure.
Not sure yet. Okay. But certainly these 2 public hospitals, they can go and see that. Okay. Thank you very much for your for sharing this new treatment available in Hong Kong. To learn more about this, please visit scmp.com.